Uma kind of hit the nail on the head. As a county, Montgomery County does very well on the South criteria. But when you dig underneath the overall county numbers, then it really depends on the particular community you're looking at and what you're seeing, but there can be a range of different challenges. So if you say Montgomery County as a whole, it's going to be
long range.
Long range. That may be it.
That's okay, Tony. It's good to see you. There is already a coalition here that's been coming together to look at how they can be responsive to the RFP when it's issued. So we're definitely mindful that of all the communities in Montgomery County, from a geographical standpoint, Long Branch is a very good possibility, presents a good possibility. So we're definitely mindful of that. The question, of course, is there are also other communities and subpopulations, and our goal would be to try to integrate as much as possible. So we've got some work to do. But there is a coalition, and anybody who's interested can talk to Bruce. He's kind of leading that work, and we're delighted that that work is happening.
If I could just follow up on that question, because I see the criteria in Long Branch, which is where we are right now, is a very large number of undocumented immigrants. They don't meet the criteria there. You can't check for Medicaid usage and for tax credits and that. So how will you be able to understand those additional needs that a community may have? And it's huge in the Long Branch area.
Sure. So one of the key concepts is that we have eligibility to get in the door, just to get in the door. Then once you're in the door, the eligibility criteria don't matter. You have to explain the need, and you can use whatever data you want, and you tell the story about the need, and you explain what you want to do to address the need. So the Medicaid and WIC were the draft criteria we put out there just to identify. I think this area lights up on the map. Yeah, so you're in the door. You're in the door. You can go to the website, you can see which zip code. So even under the draft that we proposed, you're eligible. And then, that doesn't matter. It's really about what are the key targets, what do you tell us the story about what the health needs that are contributing to disparities are, and what your plan is to address them. So it doesn't matter after that. We're not looking to see the number of people on Medicaid, the number of people on WIC. That's not a criteria.
So if I could just say one other thing. There were lots of comments that went from Montgomery County, and some of them were comments on the draft about the criteria too. We struggle with this even with the federally qualified health center designation. The medically underserved area or medically underserved persons. That issue has been with us for a long time. We're struggling with it. I'm looking at Peter. He's trying to get an application through, and what geography do you pick, and how do we do this? So I just think that at some point, how poverty is calculated also has to be examined beyond the HEC. I think that's an issue that we all need to continue to advocate around. So Delegate Gutierrez, your comments are really right on target on that. Thanks.
Hello, my name is Dr. Butler, and I'm with Gapbuster Incorporated, and I just came from the International AIDS Conference. And I'm looking at your lack of access, unhealthy behaviors, and health inequities. Now, I don't see HIV anywhere on this map, and I'm really concerned since Maryland is within the top 5 for 5 states in the United States. Montgomery County is the 3rd highest for new incidence of HIV, and is affecting minorities at a disproportionate rate. And I don't understand why that has not hit the target, especially in my community, why it's not here anywhere on this map. So I would really like that to be looked at and addressed, because we are dying at alarming rates right now. And after leaving this conference, getting more information, and it was very interesting how little bits of publicity had come out about this conference. And here it is right in Washington, D.C. I didn't see a lot of any of our face from Montgomery County there. And a lot of international folks. And here it is in Washington, D.C. D.C. is number 1. We're number 3, number 4 in the state. What are we doing about it? Why isn't that part of your initiatives here? I really am concerned because it's affecting my people, African American youth and African American females. So please, I would like to see some of that, to address that, please.
Thank you. Thanks for those comments. I'm the former health commissioner of Baltimore City, where HIV is a tremendous crisis and remains so. Couple things. The maps there were the eligibility maps that were proposed. They weren't trying to identify problems that need to be addressed. It was just to identify the eligible areas. But then, to come forward and say what you want to focus on, HIV is absolutely something that a coalition could put forward. Okay, so, you know, there are different tools, and there's obviously different funding that comes for HIV from other places, and there's a lot that's going on. But that if a community says, you know, we're going to focus on HIV, and here's why it's a disparity, and you know, Baltimore City, you know, the numbers are just staggering in terms of the rate of infection. This is what we're going to focus on. Here's how we're going to do it. It's absolutely eligible. So it's definitely possible to do that. I think you'll see that that'll be an option, but it'll be up to the community to come forward with that kind of proposal and explain what it wants to do and how it'll have that impact.
Hello, I'm Virginia Richardson, and I've been around the county looking at and thinking about worrying about healthcare for 40 years or more. And this is a very wonderful, exciting, I'm sure will be a very fruitful method. I applaud you all for doing this. But my question is, there are maybe 100 to 150 people out here. I think we're all really fascinated here. What we could do, or what you have in mind, for what we could do to be of real help to you. There must be something that the community can plug into. Tell us what it is.
I think that what I would love to see, and this is a tremendous, you know, showing of people here, really, is the different areas that are interested come together and put together coherent proposals for health enterprise zones and want to lead those. That's what we really want to see. We want to be able to support action at the local level. We want to help you. I mean, you know, it is the area where, you know, in the city, when we focus on a particular issue, we focused a lot on infant mortality when I was the health commissioner, for example, and we had, you know, I wanted resources to help me do that. We put together a plan for the city. We focused on sleep-related deaths because we thought we could have an impact there in a short period of time. There were 20 babies a year that died from sleep-related deaths that were totally preventable. We put together a coherent plan. We had tons of community partners, and we wound up getting significant funding externally for that plan. They decided to do a public education campaign. They interviewed mothers who had lost their babies, looking right at the camera. If you've never seen it, they're very brutal, difficult videos to watch. And they were shown all over the city, and there was a significant decline in those deaths, and the infant mortality rate improved to a record low. So you can, you know, make progress by figuring out what the right target is, and then pulling together and seeking resources. And we're trying, and it's not just through this. And let me say, you know, this is a particular initiative. It's not a lot of money. It's great to have, but we're trying to organize as much as we can in public health around the local level. And how many people are here familiar with the SHIP program and the work being done through the coalitions in Montgomery County? So we've gotten a number of grants where we could, I have the authority to designate where every dollar is being spent, but I'm not doing it. I'm sending it to, and the commission does also, we're sending it to the local coalition so that they can invest in the kind of priorities that they have. We want to empower people who really understand the problems and the solutions to do them. So it's really what we can do for you.
Hi, my name is Alfie Noble. I'm new to the area. I'm chief faculty at Georgetown University in the Department of Psychiatry. And I'm just curious, have people in here who are professionals and academics to have access to resources to be able to identify what some of the problems are in terms of data and statistics. And I'm wondering how would, or can you give us some advice about how communities or individual members who are non-academics, where can they go to identify some of the data that would help them make a strong argument for what they're proposing to address in terms of health disparities in their communities?
It's a great question. We are making some data, every bit of data we can that we have right now available, and we're, over time as this initiative rolls out, I think we're able to get more and more data to help people. But there are a lot of other sources, and the county here is, especially in good position, and maybe Uma can talk about what you think.
So Secretary Sharfstein talked about something called the SHIP in Montgomery County. That's called Healthy Montgomery. So you can go to www.healthymontgomery.org, and it's very data rich. The problem, I think, is some of that data is not available at the census tract and the subpopulation level. So a lot of the disparities data is a little skinny, but I would also say that the county has 3 minority health initiatives. And the Latino Health Initiative, the Asian American Health Initiative, and the African American Health Program. And each of them has over the years produced data reports that highlight what are the disparities experienced in each of those communities. And those reports can be accessed through the Montgomery County Department of Health and Human Services website. So that's another location that you can go to. And if you don't have any success, just write me and I'll figure out a way to get it to you. Whatever we have, we need to do more. One of the questions we're going to start asking in our intake is not just ethnicity data, but country of origin and language spoken. Because we think those 2 questions will give us further granularity in terms of the subpopulations that we want to collect data on.
Yeah, so it's a bit of a moving target over time, but there's a lot around here. One other point I think is really important. In an area for an enterprise zone, it is not necessary that there be a health disparity in that zone. In other words, it may be that the zone is relatively homogeneous, or there's a particular problem, just demographically. The issue is that are the health problems that are contributing to disparities. So, for example, if you take a part of the city, which is where I live, which may, for example, be largely African American, you don't have to prove that the African Americans in that area are doing worse in that area. But if they're for a particular health outcome, but if their health outcomes are poor for a particular problem, and that's contributing to the overall problem, that's enough. So it lessens the data requirements, in having to reach that extra threshold and getting data about comparison within an area. If it's bad, and it's obviously contributing to the health disparities, then that's enough.